Hey, Dave with Line Therapy here. I had a research article come through my email inbox recently that I wanted to share and talk about, and it's specific to adult spinal deformity, which is not the bulk of the research that's coming out or has come out. So it was kind of nice to see that there was a research article on adult spinal deformity or adult scoliosis. I'm here in St. Augustine, Florida. I just went to a conference in Orlando, and we're hanging out in St. Augustine for a couple of days. So what a beautiful area to do a little research article review. Thought this morning would be a good time to do that. So I had this come through my email inbox last week and thought I'd talk about it a little bit. So let me just give you the title of that research article. It is Economic Burden of Non-Operative Treatment of Adult Spinal Deformity. So it's looking at what the cost is of adult spinal deformity treatment that's performed non-operatively. One thing that's crucial to know in this is that non-operative treatment, let's see, non-operative treatment, where'd it go? That includes NSAIDs, so ibuprofen and other anti-inflammatories that aren't steroids, narcotics, muscle relaxants, epidural steroid injections, physical therapy, and chiropractor. It didn't really specifically look at like the Schroth method or any specific method for scoliosis treatment. It looked at just generally non-operative treatments. So they were comparing all those treatments combined or not combined, any of those treatments in treating patients with adult spinal deformities, and comparing that to surgery and the benefits. So the things that they looked at were the quality of life and the Oswestry Disability Index, which is an outcome measure that we use with our patients as well. So what they found, just if we skip down to the conclusion, they found that patients with adult spinal deformity undergoing operative treatment at baseline had greater sagittal deformity and greater improvement in quality of life post-operatively compared to patients treated non-operatively. So what that means is basically the more severe the sagittal plane deformity or rounding forward of the back, the more likely they were to go to surgery. That makes sense in that the more severe the deformity, the more likely they are to go to surgery. And those in this research article, it did show that the more severe the deformity, the better the quality of life and the more reduction in the Oswestry Disability Index there was because of surgery. So that one takeaway from that is that surgery is effective in reducing deformity, and it's helpful in reducing the disability that goes along with it. But that's in more severe curves. If we go down further in the conclusion, it says patients in non-operative cohorts overall had an increase in the Oswestry Disability Index and did not show improvement in utility gain. So the conservative methods that they used in this study didn't show that they really helped the quality of life as much or the disability these patients had. It did say patients in the non-operative cohort who had low disability and sagittal deformity underwent successful maintenance and cost-effective treatment. So this study isn't telling us that it's not cost-effective to treat non-operatively. What this is showing is that the more severe the deformity and the higher the disability with these patients, the more that they could benefit from surgery, and that the non-operative treatments that they're doing in this study, that those weren't as effective. And I agree with this. The more severe the deformity when we treat with the Schroth method, or we're treating with just strengthening and things like that, the more severe the deformity, the more the less effective those interventions are going to be. But one point that I wanted to bring up is they didn't really specify what type of physical therapy was provided with these patients. This could be just going to a physical therapist that doesn't have any knowledge of scoliosis. This could be, you know, anything like that. Any type of treatment that is around could have been included in this. And so one thing to keep in mind, that's not specifically for a scoliosis specific intervention. If any type of intervention is used in physical therapy, why wouldn't we want it to be specific to scoliosis and specific to spinal deformities? We got a nice big helicopter coming behind us. Look at that. It's kind of hard to hear though, probably. Pretty cool. So back to what I was saying. In this article, there's it doesn't really specify what type of physical therapy is used for this. It talks about just physical therapy. It talks about medications, injections, chiropractic. I mean, there's a lot of things that this includes in conservative treatment, and the problem is that it doesn't specify. So this could be going into someone that doesn't know what they're doing with scoliosis. This could be, and this isn't just scoliosis, this could also be kyphosis. This could be going in to see someone who doesn't ever manually do anything for that patient, and they're considering that the same. And I think that's important to note. It's an interesting study to show that, yeah, with smaller deformities, we can see good results and manage those without surgery. But the bigger the deformity and the more disability that's happening from that deformity, I think the more specific we need to get with our interventions, with more specific with someone who's trained in scoliosis specific exercise, the Schroth method, the SEAS approach, something like that. It's not just a general physical therapy approach, not just core strengthening, not just stretching the hamstrings and doing some dry needling, something that's specific to the curve. So that was my big takeaway from this. You know, initial reaction with this is that, oh, it didn't really show that good of support for conservative treatment. But the more you dive into it, the more it's like, we have some room here to do some research on adult scoliosis, which hasn't been done that much, and to see if it is really effective with using the Schroth method, with using things that are scoliosis specific. So I thought this was a good study. It was done by Journal of Neurospine Surgery, I think, and so they're part of the SRS, the Scoliosis Research Society, which is pretty much all surgeons. So take that for what it's worth. There might be a little bit of bias involved in that. It does show that surgery is effective in helping the quality of life and deformity and the disability that comes along with it. But we also have to keep in mind that this study was not done specifically to see if scoliosis specific exercise is effective for these things. So if you have adult scoliosis, adult spinal deformity, I would definitely recommend looking into conservatively managing this. The cost for conservative management to the patient in this study was a little over $2,000. The cost for surgery is definitely higher than that, and so I think it's worth a try, especially if your disability isn't way high and your spinal deformity isn't way high. Conservative should be where we're going first, and in my opinion, even with bigger curves, conservatively treating it with the Schroth method and other things like that is also a good place to go. So hopefully this was helpful, and hopefully more research is coming out about adult scoliosis treatment and the Schroth method with adults, because really that's where it kind of all started, but the research really isn't looking into that as much. So hopefully this was helpful. Subscribe to the channel. Make sure that you follow us to see more research that comes up. And hopefully this was informing and can help you to make better decisions about scoliosis treatment. And until next time, this is Dave from St. Augustine. And little good look at how beautiful this area is. And hopefully you're doing well. Thanks.